there are studies which show that the presence of depressive symptoms do not just coexist with cognitive impairment or cognitive deficits, but also that the presence of depressive symptoms is related to core aspects of the pathomechanism of Alzheimer's disease. For instance, one of the most important genetic risk factor for Alzheimer's disease is the presence of the epsilon 4 apolipoprotein, of the epsilon 4 allele of the apolipoprotein epsilon. There are studies which point out that individuals without cognitive impairment who carry the epsilon 4 allele do have a higher risk for the development of depressive symptoms of depression compared to those who do not carry the epsilon 4 allele, while those who carry the epsilon 2, which is a protective factor against the development of Alzheimer's disease, those who carry the epsilon 2 all have a lower risk for developing depression. Excuse me, sorry. In addition, there is another current study which points to the fact that individuals without cognitive decline but with depression do have higher levels of amyloid load in their brain compared to age, sex, and education matched individuals without depression. And we know that amyloid levels and increased amyloid levels are one of the pathological hallmarks of Alzheimer's disease. So it seems that depression is related, does not only coexist in many cases with cognitive deficits, memory deficits, orientation problems, problems with attention, concentration, but also it pertains to core aspects of the pathomechanism of Alzheimer's disease. All these data motivate us to try to shed light on the potential diagnostic utility of depressive symptoms.